Ever wondered why arthritis is not just an old person's disease, or why rheumatoid arthritis is not just another type of arthritis? In our quest to unravel the truth about arthritis, we come across numerous misconceptions. One of the most common misconceptions is that arthritis is a singular disease, when in fact, it's an umbrella term for over 100 conditions that cause joint pain or joint disease. The term arthritis paints a picture of a world brimming with diverse conditions, each with its own unique characteristics, causes and treatments. It's not confined to the elderly, and it's not a condition that's merely an inevitable part of aging. Arthritis can affect anyone at any age, from the young and sprightly to the old and wise. Now let's shift our focus to another common misconception, that rheumatoid arthritis is just another type of arthritis. While it's true that rheumatoid arthritis falls under the wide umbrella of arthritis, it's not merely another type. Rheumatoid arthritis is an autoimmune disease, a condition where the body's immune system mistakenly attacks its own cells. In the case of rheumatoid arthritis, the immune system primarily targets the lining of the joints, leading to painful swelling, stiffness, and in severe cases, bone erosion and joint deformity. Unlike some forms of arthritis, rheumatoid arthritis isn't limited to the joints. It can affect a variety of body systems, including your skin, eyes, lungs, heart, and blood vessels. But here's the clincher. Rheumatoid arthritis doesn't discriminate by age. It can affect anyone, young or old. So the next time you hear someone say that arthritis is just an old person's disease, or that rheumatoid arthritis is just another type of arthritis, you'll know better. So age does not exclusively define arthritis, and rheumatoid arthritis is a distinct entity. Let's delve deeper into the world of rheumatoid arthritis. A rheumatoid arthritis is not merely joint pain, it's a tale of immune system betrayal. So let's dive into the physiology and biology of this condition to better understand what's really happening under the skin. In a healthy body, the immune system is your knight in shining armor. It protects the body from harmful invaders like bacteria and viruses. But in the case of rheumatoid arthritis, this knight gets confused. It mistakenly identifies the joints as enemies and begins to attack them. This is what we call an autoimmune response. So how does this happen? Let's break it down. The main players in this internal drama are the T cells, B cells, and the chemical messengers known as cytokines. T cells are a type of white blood cell that play a crucial role in the immune system. When they detect a threat, they trigger an immune response. In rheumatoid arthritis, these T cells are misinformed. They falsely recognize the body's own tissues, specifically the synovium, the lining of the joints, as a threat. Once the T cells are activated, they stimulate B cells, another type of white blood cell. The B cells then produce antibodies against the body's own tissues, causing further damage. At the same time, T cells also release cytokines, which are like the body's internal mail system. They deliver messages between cells. In this case, the message is to increase inflammation in the joints, causing swelling, pain, and over time, damage to the joint tissue. What's fascinating and somewhat cruel is that this process repeats in a vicious cycle. The more the immune system attacks the joints, the more inflammation occurs, leading to more pain and damage. So you see, rheumatoid arthritis isn't just a simple case of joint pain. It's a complex and ongoing battle happening within the body, where the immune system, the body's protector, becomes its own enemy. And that's the science behind rheumatoid arthritis. It's a sad tale of betrayal, where the body's defense mechanism turns against itself, causing pain, inflammation, and joint damage. In essence, rheumatoid arthritis is a war within, where the immune system turns against its own body. Time is of the essence when it comes to diagnosing rheumatoid arthritis. As we delve into this topic, let's first explore the common symptoms. Rheumatoid arthritis often begins with subtle symptoms such as fatigue, morning stiffness, and minor joint aches. However, as the disease progresses, these symptoms become more pronounced and may include swelling, warmth, and pain in the joints, often in a symmetrical pattern affecting both sides of the body. Now let's move on to the diagnostic tests used to identify this condition. Rheumatoid arthritis is primarily diagnosed through a combination of patient history, physical examination, and laboratory tests. During the physical examination, physicians look for signs of inflammation such as swelling, warmth, redness, and pain in the joints. They also assess the patient's range of motion and overall physical function. Laboratory tests are a critical part of the diagnostic process, providing valuable information about the presence and severity of inflammation in the body. Blood tests commonly used in diagnosing rheumatoid arthritis include the rheumatoid factor test, an anti-cyclic citrullinated peptide antibody test. These tests measure specific antibodies in the blood that are often present in individuals with rheumatoid arthritis. Another important test is the erythrocyte sedimentation rate, which measures how quickly red blood cells settle at the bottom of a test tube. A faster than normal rate may indicate systemic inflammation. Imaging tests like X-rays, ultrasound, or MRI scans can also be conducted to help detect joint damage and monitor the progression of the disease. This may seem like quite a comprehensive process, but it's important to remember that early diagnosis and treatment can significantly help manage the disease and prevent joint damage. Essentially, diagnosing rheumatoid arthritis is not a one-size-fits-all process. It requires careful consideration of a variety of factors and tests. It's akin to piecing together a complex puzzle, where each symptom, each test result, each piece of the patient's history is a critical part of the bigger picture. And there you have it. Diagnosing rheumatoid arthritis is like piecing together a complex puzzle, but every piece leads to a clearer picture. Living with rheumatoid arthritis is not a death sentence, it's a call to arms. This condition requires a proactive approach to management, and today we're going to delve into the many ways you can take control of your rheumatoid arthritis. Treatment options for this condition are as diverse as the individuals who live with it. It's important to remember that no one-size-fits-all solution exists. Instead, a personalized treatment plan is key. With the guidance of your healthcare team, you'll develop a plan tailored to your unique needs and lifestyle. Medications often play a significant role in managing rheumatoid arthritis. These can range from non-steroidal anti-inflammatory drugs, or NSAIDs, which reduce pain and inflammation, to disease-modifying anti-rheumatic drugs, known as DMARDs, which can slow the progression of the disease, but it's not all about medications. Physical therapy is another crucial aspect of management. A skilled physical therapist can teach you exercises to help keep your joints flexible, maintain muscle strength, and improve your balance. They can also show you how to use assistive devices like canes or walkers to make daily activities easier. Then there are the lifestyle changes. Simple adjustments can make a world of difference. Eating a balanced diet rich in fruits, vegetables, lean proteins, and healthy fats can give your body the nutrients it needs to fight inflammation. Regular exercise, meanwhile, can help keep your joints limber and your muscles strong. And don't forget about the importance of good sleep and stress management. These can significantly impact your overall well-being and your body's ability to cope with rheumatoid arthritis. Surgical interventions may also be considered for some individuals. These procedures can help restore function to damaged joints and improve quality of life. Remember, managing rheumatoid arthritis is a team effort. You, your doctors, your physical therapist, and your loved ones all play a crucial role. It's about finding what works best for you and sticking to it. While rheumatoid arthritis is a lifelong battle, it's one that can be managed with the right strategies. You're not alone in this journey. With determination, knowledge, and the right support, you can live a fulfilling life despite rheumatoid arthritis. Arthritis and rheumatoid arthritis, two terms often used interchangeably, but are they the same? Not quite. While both conditions involve inflammation of the joints leading to pain and stiffness, there are key differences to note. First off, arthritis is an umbrella term, encompassing over 100 different types of joint diseases. It can affect anyone regardless of age and can target one or multiple joints. It's like a chameleon, changing its form depending on the individual. On the other hand, rheumatoid arthritis is a specific type of arthritis, an autoimmune disorder where the body mistakenly attacks its own tissues, primarily the synovium, the thin membrane that lines the joints. This causes chronic inflammation and can lead to long-term joint damage. In essence, while all rheumatoid arthritis is arthritis, not all arthritis is rheumatoid arthritis. So arthritis and rheumatoid arthritis, while similar, are distinct conditions with their unique challenges.